Well, hello and welcome, everybody. Thank you for joining our When Billing Becomes a Burden webinar today. My name is Jared Barrett, and I'm a Senior Product Marketing Manager here with ChiroTouch's Billing and Payment Solutions, and I'm so excited to be here today. I'd like to introduce and extend a warm welcome to Christine DeFrancisco, Vice President of RCM Operations. Christine is a seasoned healthcare executive with over 25 years experience across diverse sectors, including ambulatory care, hospital-based care, clinic research, and health IT. Throughout her career, she has held leadership roles that span the full spectrum of healthcare operations. For the past 8 years, Christina has specialized in health IT, where she leads revenue cycle management services with a strategic focus on ensuring solvency and sustainability for small market healthcare organizations. Her experience bridges clinical insight and technology-driven solutions, making her a trusted leader in advancing operational efficiency and financial performance in the healthcare industry. And with that being said, I'll go ahead and pass things over to you, Christine.
Thank you so much, Jared, for having me today. I'm super excited to discuss ways to modernize your current practice operations, and I've divided that into about 4 different sections. So let's start. I always like to start with the current state of the market so you can understand where my thoughts are and where we have to modernize and take advantage of, specifically for the chiropractic market, the exploding growth in the industry. I also want to review post-COVID challenges in hiring and retaining great staff. And then in the end, of course, I just don't want to highlight how the struggle is, but I will also speak to how we can overcome those. I always like to touch on, and in this case, I'm going to sort of lean into key performance indicators. KPIs are the critical foundation of understanding how your business is operating and where you can improve. We baseline clinical measures in our patient populations, but we don't always do the same thing for our business. So I'm going to talk about the ones that I think are really imperative to managing your business and why I like them. And then, as promised, I will tie this all together and discuss how we can leverage economies of scale to bring your practice into the next level. So with that, I'm going to jump into where the market is today. I want to start, and the reason why I chose this infographic is I want to show the unbelievable hockey stick-like growth that our market has seen over the last 5 years and the projection for the growth that is forecasted for the next 5 years. The U.S. chiropractic market is now valued over $450 million and is anticipated to grow at a compound annual growth rate, or what we call CAGR. It's listed there on the infographic on the right. That's projected to grow over 26%. Most medical specialties benchmark right now at about 6 to 15% for the next 5 years. So you can see this market is slated to grow 200 to 300% faster than the rest of other medical specialties. This growth is inherently great news, but it does present problems and challenges when managing the business. I want to highlight a couple of key statistics that I think will also represent sort of where the market is today. National estimates of the Bureau of Labor Statistics state that there are about 38,000 chiropractors currently employed today, which honestly, when I was doing my research, I was very surprised at how many that was. And according to the American Chiropractic Association, chiropractors provide treatment for over 35 million Americans each year. The single biggest driver of this growth is our aging population and the management of their chronic diseases. Diseases like arthritis, degenerative disc disease, joint pain are now commonly treated in the chiropractic space. Many seniors are seeking chiropractic treatment for mobility, balance, quality of life, and they're getting much better at shifting from that acute care model mindset to preventative and, of course, maintenance care. In treating older patients, it also requires those age-related considerations like osteoporosis, fall risk, polypharmacy considerations. Outside of the aging population, there are also numerous additional reasons for the balloon in growth. The second significant market driver is the rise in demand of non-pharmacological pain medication or pain management. The widening acceptance of treatments by patients who choose non-invasive modalities for chronic pain has been a huge market shift over the last 5 years. and is where I think we're going to see that a lot of that market growth because of the risk and reuse of and overuse of prescription pain medication. The awareness is not just among patients, but also our referring providers are now seeking non-opioid options for pain management. Even certain state Medicaid programs have expanded chiropractic coverage as part of their opioid reduction strategy. So, that is something to look at. I know normally we would poo-poo away Medicaid programs, but a lot of them are paying Medicare rates really to support their beneficiaries and keep them out of that acute setting. We're also seeing chiropractors really being integrated into that multidisciplinary care teams, especially in physical medicine, occupational health, in the VA health systems. This has allowed for the diversification of services into massage therapy, nutritional counseling, wellness programs, which also then affects the evolution of being a strict cash-based industry into the insurance-based market as well. We are even seeing efforts by the FDA to produce and provide clinical support documentation for chiropractic treatment that will also contribute to market growth and allow for those justifications for insurance coverage and that security that patients can move to a more comprehensive approach to their care. And the final market driver that I want to briefly touch on is the growth of private equity-backed groups acquiring independent clinics to create these regional and national brands. While it's not necessarily driving market growth, it's impacting privately owned and solo practitioners. Venture capital and PE groups increase competition around negotiating payer contracts, marketing, affecting provider retention, staff retention, but most importantly, they have those economies of scale that allow them to operate with lower overhead and higher margins. We're already seeing PE groups offer more competitive salaries, benefits, growth opportunities, which is drawing talent away from the small practice. Additionally, PE and VC-owned groups leverage centralized billing, big market centralized programs, and CBO or central business operations for their administrative functions. Again, that reduces overhead and increased profit margins. And this makes it harder for the small independent markets to compete. So whether you're part of a large group or an independent small market, the market pressures and business fundamentals remain consistent. Success means focusing on both that patient-centric care, which drives loyalty and trust, retention, while not losing sight of the operational and financial strategies that maintain strong and scalable practices. Regardless of the industry, success business has to prioritize cash flow into the door. Or as I like to say as a consultant, cash is king. That is why that is the center of our bespoke model here. While there are countless efforts to influence practices' cash flow, they can generally be grouped into these 6 overarching categories that are all interconnected. So I tried to drill each of these into one of these 6 categories. I'm a super process-oriented person, so I like to call it what I call the so-called beginning. And that's getting these patients into the door. And that starts with marketing, saturation, looking at your competitors. I literally could spend an entire hour on, market drivers, market saturation, competition. And I've already mentioned the consolidation of big VE and PE firms acquiring the independent practices to create these regional and national products. But what I really want to focus on is the details around economies of scale. And I'll do that towards the end of the presentation. So we can compete with these national brands. And really, they have that brand recognition, but patients are primarily driven by convenience, easy access, that one-stop shop environment. I'll tell a quick story here where I can I can say that my husband has degenerative disc disease between L5 and S1. And we literally chose this chiropractor because it is 2 blocks from our house. So he walks there. They also do decompression therapy for him. And so and we love to support those independent practices. So having somebody in the neighborhood that he can do multiple modalities in one stop has been life-saving for us. But you also need to have a strong, online reputation and digital presence. And again, you don't need a giant marketing team to do that. And I hope you guys all know that we have a patient engagement tool called CT Engage that is powered by Doctable that really integrates with our programs here to get you those patients into the door. But once you have patients in the door, you have to have staff to manage it. While the labor shortage didn't begin with COVID, the pressures on staffing have persisted and in many cases has intensified. Certainly, it's going to continue to intensify as we see that hockey stick growth over the next 5 years. We face challenges in hiring, training, retaining is a big one, and especially with those key qualified, higher skilled team members that really effectuate efficiency, patient experience, and of course, a big one, patient capacity. Consistent, well-trained staff will remain essential to maintaining that operational efficiency, stability, and growth. So once we get patients in the door, we have staff to manage them. We have to get them back, right? That is a key part of your success in chiropractic, is not the one and done like you would with, let's say, an urgent care. And this can often be heavily influenced by market competition. And so that strong doctor-patient relationship is always going to be the foundation. But there are also significant things that our support staff can do outside of that doctor-patient relationship. Efficient communication, proactively following it via text, email, phones, making sure that, patients understand the plan of care, reminders, also recalls, right? So if a patient hasn't been in, are we following up with that patient to get them back in the schedule, to really keep them engaged in the practice? And then really one of the most important things is clarity around benefits and costs. Patients want to understand what they're going to have to pay, and they want that ahead of time. So they clearly communicating what's covered by insurance, what's going to be out of pocket costs, even if you have insurance. That could be deductibles, co-pays, and then what's included, especially as we are expanding into things like acupuncture, massage, laser treatments, decompression, specific kinds of scans. All of that could have a share of cost. And if you are talking to your patients about that ahead of time, you are likely to be able to retain them. And of course, convenience. So oftentimes, like offering scheduling options where you are, like coming in the morning, seeing patients in the evenings, and reducing wait times in the office. I can't tell you how often I'm consulting with chiropractic practices. And when I am looking at their wait times, you have a patient there from 5 to 15 minutes, and they have to wait 30 minutes for that. They are not coming back. So that is really focusing on some of those will really enhance the patient experience. So the third one, and this is where I often lose people, is documentation and regulatory. I'm not going to talk compliance or OSHA or HIPAA, but really when you are focusing more in your non-cash business, documentation requirements are essential. And doing that correctly can be time consuming. And this is the biggest way people often end up leeching money. If you're doing any kind of appreciable Medicare or personal injury, it is imperative that this is not only done correctly, but timely. Remember, in many states that you are required to send your PI cases out within 30 days to secure that timely filing requirement. And payers especially around Medicare. And, the requirements for documentation include functional impairment, treatment goals, measurable progress to justify ongoing care, detailed treatment plans, and that all leads to that appropriate coding. Because of these complexities, the revenue cycle management team has added a senior director of compliance and quality, Gina Shirato, to our team. I am so excited to have her because she has about 35 years of podiatry experience specific around quality compliance. And we are going to be doing a few separate seminars in the coming months to really drill down to keys to success, such as coding, use of modifiers, payer specific requirements, credentialing. So please stay tuned for that. But I'm going to be partial to this as the Vice President of Revenue Cycle Services. One of your biggest risks to managing a business today is those payer complexities. And insurance billing and personal injury claims are always going to be that big, hairy behemoth of your practice. These complexities are variable between insurances. It's even variable within the insurance, depending on whether you have an EPO or a PPO or an HMO. And so that is a huge risk to the business. I could give hundreds of examples, but I'll give you just a couple here, right? When do you send your claims to Blue Cross Federal versus ASH? What member ID do you use for your VA claims? Because they don't issue cards the way commercial insurance does. And where does that member number go on the claim? What payers require prior authorization? And where does that auth number go on the claim? And how do you make sure it's getting to your claim? And then, of course, there are very specific nuances in chiropractic services or in billing for chiropractic services. And I haven't even touched on the PI work. So, another good example I just want to throw out there is that Medicare covers chiropractic care, but only for spinal manipulation for subluxation. They don't do exams, therapies, wellness visit. So it's going to limit your reimbursement potential. And then the last comment I want to make in the overarching landscape is technology. I work for ChiroTouch EHR, but your technology needs to be efficient in your documentation, streamlining your charts, your coding, your medical necessity, making sure you're documenting. So if there are requests for medical records, you're not being denied because you didn't document something. And then also having your technology have chiropractic specific tools, such as templates, care plans, adjustment tracking to support those workflows. So each of these can merit entire classes of their own. So what I really want to focus on is the staffing, those payer complexities, and then how to track that business around these models. So let's jump in to the growing challenges with hiring and retaining quality staff. Staffing issues in chiropractic clinics are not simply just an HR problem. They are strategic risks to the financial performance of the business. And so with that, we can see on the top right that these are all provided by the MGMA, but front desk has an average of 40% turnover. Business ops support, so this is going to be your back office, this is going to be your office manager, your billers, is 33%. And of course, we're seeing this huge sort of revolving door with our providers and advanced practitioners. So as the profession evolves, ideal staff members must juggle multiple roles, right? So when we're taking a look at that stat of front office and business operations, we have to think about patient support and customer service, front desk operations, which aren't just checking patients in, it's scheduling, checking out, confirming appointments, patient recall. And then of course, We often have retail sales, which our front desk or our back office has to manage. They also have to do things like inventory manage. Also, we have chiropractic assistants that are doing those clinical tests, range of motion, postural assessments, orthotic scans. And then, of course, our back office, our business ops is largely driven by our billers who have to understand the business operations end to end, right? Patient has insurance. What's covered under that insurance? Not just do they have insurance, but what are their benefits? Can we balance bill under this insurance? Are we sending claims to the payers within the standard, 48 to 72 hours? Are we working those rejections? Are we posting payments, doing AR follow-up? And of course, our office manager, which is often, a family member, it can be somebody that's been with you for 30 years, has to do all of this, support as well as HR, payroll, ordering, compliance, paying the bills, right? Somebody has to pay the bills. And if we hire individual seasoned employees for each of these functions, you are going to have a prohibitively large team that's going to be incredibly expensive. So what I should have named this slide is not growing challenges, hiring and retaining staff, but chiropractic staff, unicorns, because oftentimes that's what it feels like. We are having to staff unicorns that have all of those things that I just mentioned, but they also have to have soft skills like adaptability, efficiency, that empathy with patients. So let's jump into some of these real nitty gritty. So with the wage competition, in the post-COVID world, we see retail, even things like services like fast food, tech industries have raised their wages so much, and they offer flexible schedules. Oftentimes they introduce remote work. It is drawing away from our front desk and our administrative staff. And this is especially impactful in your lower wage regions. And, oftentimes we're struggling to match these offers because we do have limitations, with our payer reimbursements and those thin margins. But even if we can compete in the wage market, there is an inadequate pipeline of trained professionals. And these do not need to be high skilled professionals, but you have to have teams trained on, checking those benefits, payer requirements, customer support, and specifically trained employees that understand the chiropractic specific aspects of the business. And training programs are just not keeping pace with the demand, and practices are really struggling to carve out time for that ongoing staff development. And that's a key thing, is when we are already behind the 8 ball with staff, how are we carving out that staff development? Again, job training is going to be required to really get chiropractic specific staff that know how to manage your business. And of course, with that hockey stick growth we're seeing in the market, we have increased patient demand and patient volumes, but it's not just around the aging population and the non-opioid pain management, but there's other factors. For instance, we have an aging Generation X, and Gen X is, nearing retirement age, and they're more inclined to seek holistic health, that comprehensive health care. They're more focused on their well-being than previous generations. They also focus on tech-driven personalized care. I want to sort of emphasize that, because this is where your patients are. It's not just more volume, but they want that seamless, personalized, tech-enabled experience. And that's from online booking to, instant access to their health records, messaging their providers, things that patients are accustomed to in other offices. They really are going to start expecting that in our practices here. And another thing that increases the patient demand is, around those regulatory burdens is patients who have insurance are not going to take cash. They're going to go find a provider that is in network with the Blues or who takes their VA benefits. And this adds a huge burden to practices compared to our cash only competitors. And of course, the complexity of, payer rules changing. Another big one I need to call out is, of course, credentialing, making sure we're keeping up on our credentialing. This is all going to take time away from both the clinical staff and, when you have your clinical staff focusing on non-clinical tasks, you are going to reduce your ability to see patients. Another big one we're seeing is when we are a smaller group practice or an independently owned practice, a lot of roles do not have growth opportunities, right? You do not have a front desk team that may require a front desk lead or manager or, supervisor. And so our front desk and our billing specialists often have limited advancement, and that's really promoting the high turnover to other practices that can offer those opportunities, or they have to leave to get promoted. And again, leaves that gap. So that's another thing really to consider is, when we're starting to see PE firms that are centralizing their operations, they're going to be able to offer these growth opportunities. We, of course, have geographic disparities that are really impacting our rural or underserved areas, where not only are we not able to attract skilled talent, but we also have fewer local training institutions where we don't have those tech colleges that are able to train up staff that then come into our market. This is also happening not just in the rural markets, but also in large metropolitan areas where we see saturated markets, where you're going to be, competing with other practices for those staff. And of course, post-COVID, people need to have that flexibility and that work-life balance. People got used to working from home. And so really, if they can get a job, in a something as simple as a server that they could be making $25 an hour and tips, they are going to do that after hours when their husband is home and they stay home during the day, or vice versa, right? There's a lot of these logistical considerations with work-life balance that we really need to focus on. Okay, so I just want to circle back on the staff management. I'm not going into detail with each of these visualizations, but I want to point out how, staffing impact every one of these bespoke buckets on every level, right? We generally think that the staff impacts are really isolated to this sort of concept that, oh, it's just a staffing problem. But realistically, it's going to impact everything else, right? But the biggest impact on your staffing challenges are going to be here in managing your non-cash based business, right? Again, I mentioned timely filing of PIP claims, right? Or following up on your standard insurance claims. You should be seeing remits within 14 to 35 days. Once those come in, do you have the staffing to follow up on that, right? How are your staff following up to see if you're getting paid according to your contract, right? And, again, do you have the staff capability to get prior authorization? And again, a lot of insurances have very specific benefits of what they cover. And unfortunately, in chiropractic care, this is not uniform, right? So it's not like all commercial insurances pay for certain modalities. Some of them will limit, your ultrasound, your TENS machines per visit. And so what you end up doing is you end up overutilizing the services, and then you find out you don't get paid on them. So another key thing I just want to highlight also when we're talking about the documentation and regulatory burden is, as of May 21st, 2025, CMS, the Centers for Medicare and Medicaid, are also have announced a plan to increase audits specifically to Medicare Advantage plans. And they are doing complete audits of overutilization, and they are going back all the way to 2018. And, I don't think that's, sort of an archetype, but Medicare has been stating they have made overpayments in the billions, right? So they are going to come back and be doing RAC audits, TPE audits, things like that. So we really have to make sure that we have the kind of talent staff or the talent on staff that can manage to these kinds of requests. So with that, I am just going to make sure that I pause for a moment for questions. Jared, did we have anything come out?
Yeah, we did.
Or did anybody put questions in there?
We did indeed. We had a number of questions. We kind of whittled it down to some of the easiest to get through right now. Again, we will answer all the questions after the webinar as well if we don't get to everything. The first one was, in your experience, what's the most difficult role to fill right now? Is it technicians, front desk roles, or billers?
I can tell you across the industry, it is the billers, right? Because a lot of billers do not want to be on site. They want to work remote. And they want that flexibility. But in addition to that, then you have to track your biller, right? If they are working remote, how do you know they are actually doing what needs to be done? And additionally, in chiropractic, you cannot just hire somebody off of Indeed or Monster. They have to have clinical experience of, how to file a PA claim, how to manage subrogation with your lawyers. Are you coding appropriately? Are you adding the appropriate modifiers? Are they able to keep up on changes to LCDs and NCDs? So you can hire a biller, but if they've been billing for pediatrics for the last 10 years, it is not going to be what your business needs today. So I hope that answers that question.
I really enjoyed the response, Christine. That sounded great. We have one more that I think we have time for, and it is, how is a small practice supposed to staff for things like you're talking about, such as marketing, patient retention, and outreach, as well as billing? We have one person doing the job of 5 here.
If I had to guess, that one person is your office manager or your spouse. I see a ton of businesses where it becomes a family operation where you train your adult children to work the front desk, or they go into tech programs to help you do the chiropractic technician work. And so oftentimes when we're managing the business this way, you are juggling everything. And that makes us all the jack of all trades, but the master of none. It also makes it so we are spread so thin and everything is on one plate. It makes it impossible to do it well. And so I'm going to spend the next few minutes really going over, how to manage to this. With both tracking and how we can gain economies of scale. And I think I just peeked into the questions, Jared, and I think there was one more I would like to address in the chat from Violet. Is there any training we can take on how to bill Medicare properly? Violet, I so appreciate this question. It also scares me because you have to remember Medicare is managed by individual MACs, right? So depending on where you are and what region, that's going to be, how you manage your Medicare patients is not only dictated by national coverage determinations, but also those LCDs, local coverage determinations. And of course, how you train or how you manage your Medicare Advantage plans as opposed to your fee for service is incredibly complicated. And of course, then you have to understand crossover claims and billing. That is why I really, really encourage you to hire somebody who has that experience. And again, I don't want to pick on Violet because she may be a biller, but oftentimes we want our front desk and our office managers to understand it, because the front desk has to get ABNs, right? The office manager has to manage the staff that's doing it, but really to do Medicare billing compliantly and efficiently, you need somebody that really understands that. So I am going to spend the next few minutes on what I think may be the most important thing you can do for your practice by far. And that is, you have to track both your financial performance, which is I'm going to talk to you now, and then my next slide is operational performance. So tracking the health of your practice, I said this earlier, we track baseline performance of our patients, and then we, adjust how we manage that patient depending on their results. We have to do that with our business. And of course, when we're shifting from a cash-based business to an insurance one, that delay in cash needs to really be managed. And, so one of my favorite, and I will say this every time, is what I call average reimbursement per patient per visit. Now, if you are just doing a couple of manipulations, you may say, yeah, I get like $40, $60 a claim, but that is not how you should be measuring your average revenue or reimbursement per patient. This needs to be done over time. So it's super easy to track. How much did you bring in revenue over the last 3 months, 6 months, or a year? Divide that by how many claims or how many patient visits did you see? I will tell you, the industry benchmarks this standard at between $85 to $130 for chiropractic care. Now, I will tell you, when I talk to chiropractors, they're saying there's no way I'm getting $130 per claim. But again, what you want to focus on is, that average, over time. You may be scanning somebody, doing specific, assessments as well as manipulations. You may be doing office visits. All of that can add up on those 1 or 2 visits, whereas then the next ones are just going to be the adjustments. So if you are not benchmarking between $85 and $130 dollars per encounter, then you are leeching money somewhere, right? And again, I like to do it by taking all the money I brought in over that 6-month period, divide that by all the claims that were submitted, and then take that average over time. So for example, if you saw 2,000 patients last year, which isn't unreasonable, right? That's about 160 patients a month. And you divide that by what you collected. Let's say you collected $200,000, your RPE, reimbursement per encounter, is about $100, right? So you're tracking at about industry standards. But imagine if your billing was better and you can bring it from $100 to $110, where you're doing just slightly better because you're managing that insurance receivables. If you saw 2,000 patients and you increase that by $10, that's $20,000 a year, where you did not see more patients, you did not bring in more employees, you did not buy new machines. That is literally just being more efficient. And I will tell you, when I'm consulting for practices, always the biggest complaint from my providers is I am busier than ever and I'm making less money. That is not always because your payer is decreasing reimbursement. We know that's happening, right? That it's a death by 1,000 paper cuts, but it is also because we don't have the skilled talent to follow up on that insurance accounts receivable, right? And we're not tracking where the money is lagging. So another key that I always want to focus on in days in AR, and that is a calculation. People do it a bunch of different ways, but essentially it's how long is your insurance AR sitting there to get paid, right? And so your average days in AR for chiropractic should be about 30. Now, we know that if you're doing a ton of PIP work, that could be 200 days, right? But oftentimes what I'll do is I'll carve out your PIP work because that's going to skew your data. And your biller should be reporting that, yeah, for your insurance claims outside of PIP, it is taking about what's sitting in your open AR is on average about 30 days old. If it's lagging and it's 60 days old, you are now running into things like timely filing. And now you have a risk of never collecting it, right? So that is a big one to track, is your days in AR. Another big one is going to be your AR over 60, 90, and 120 days. So again, most of your AR, like 80% of that, should be in the less than 60 days, because you should be liquidating your AR. And again, having somebody look at what is rejecting before it even goes to the insurance. Do you have trends in that? What is being denied? What payers are denying? Because then do you have a problem payer, or do you not understand how to bill those claims correctly, right? A gross collection rate versus a net collection rate is super important as well. And of course, evaluating your payer mix over time. You do not want to be heavily focused in one particular payer, because if you start having issues with that payer and you have all your eggs in that basket, you now are crumping your business. I am not asking for the office manager or the front desk person or our clinical staff to do this. You should be getting this from your biller, whether it's an in-house biller or or from the software. The software can run some of these reports, but this is really critical to the financial performance of your business. But I don't want to lose sight, just because I'm often focused on how you're managing your AR. Operational performance is just as important, right? So again, making sure that we are tracking our new patient volumes and also comparing that to our return visits, right? So there should be, you should be looking at how many patients are actually, being retained. Also, I'm a big proponent, and I will push on my front desk staff to track no-show and cancellation rates. No-show and cancellation rates means your providers are sitting there doing nothing, and you are losing money if they have a bunch of gaps in their schedule because patients no-showed and canceled, right? So do you need better patient engagement? And of course, overall visit volume. We're going to see this hockey stick growth. You have to take advantage of that, right? And of course, as I talked about earlier, patient retention is also around patient satisfaction, right? These big groups will send out surveys after a patient visit, so you will know exactly what went right and what went wrong. And so we have to learn how to do that in our business, where we're tracking those satisfaction scores. Another big one when you're dealing with insurance-based payers is your referral source. Are these coming from internists? Are they coming from, physiatry or occupational medicine? So you can create relationships with those people. And again, I already talked about wait times. There's nothing more annoying than having a 10-minute visit that you wait 30 minutes for, okay? I can go into a whole diatribe about staffing, but again, you should be measuring the productivity of your point of service collections with your front desk. But most importantly is you should know the benchmarks of how many claims a biller should get out, how much AR they should be liquidating, what is the turnaround time to post your payments in the system. And again, if you are not posting payments, you have no idea how to work your AR, and you have no idea how to balance bill the patients who have legitimate share of cost. So staffing matrix are incredibly important from an operational standpoint. So again, I always like to sort of show you how this impacts cash, because again, oftentimes, we're tracking that KPI to see where our new patient volume is, or how many patients are returning, and our, re-engagement is another big one, like how many patients stop doing services, but then you're able to re-engage them. But you can see that the biggest thing with tracking your KPIs are going to be around that regulatory burden, documentation, and all of those complexities with billing.
There was one interesting question that came in, and it was in relation to, they said, I am the only one who tracks some of our KPIs. How do I get my boss, the DC, to recognize the significance/importance of these stats?
So number one is, if you can take some of the stats that I listed, both in operational and financial, and you can calculate that for your business, and if you are below benchmarks, for instance, if your RPE is 80 and you're like, oh my God, we could be at 100 and that's $20 more per patient visit, like how much more money would you do? And that's why I love that one, because it's easy. And that resonates with our DCs, right? Is if they can say, oh my gosh, if I'm seeing 40 patients in a day and I can bring in $20 more, that's $800 a day. Like when you conceptualize that and break it down, and again, the days in AR, if you should be running at 30, but at 60, you can tell them, how long are we waiting for our cash? Or again, if it's operational, like we only see our new patient to follow-up patients is not good. We are seeing a ton of new patients, but then they come in once or twice, but our retention and recall is bad. If you start showing them that kind of data, then you can start saying, this is what I need to efficiently run your business. And that's where I am going to lead in to this concept of economies of scale. So I've mentioned this a few times, but the biggest issue on how to capitalize on this market expansion without increasing staff and overhead that would be rate limitingly expenses is we have to gain economies of scale, which means leveraging shared resources to reduce cost. So when you partner with different people, it allows practices to tap into that enterprise level efficiency, but they can still be truly independent from a practice standpoint, right? So what happens if you grow big enough and you need 1.5 billers? And you're like, how do I do that? I can't find even a full-time seasoned biller. How am I going to find part-time, right? When you are partnering with, a billing partner, you are sharing resources across multiple, entities. So they really can, invest in each of those people. I will also say, not only are they sharing staff, but they will have their own advanced software that they're leveraging to track productivity, what I call TAT, or turnaround times, like how quickly are we posting? How quickly are we getting claimed, right? And they have an entire infrastructure to manage that staff, train them. And all of that is shared across many clients, right? And because these, when you're dealing with partners, they have a vested interest in having labor efficiency. We are going to have specialized teams that will, really understand our software, as well as, our, indication of chiropractic medicine. So we are able to manage at higher volumes and more efficiency. There's also cost predictability, right? How complicated is it when, all of a sudden you feel like you have to replace somebody because they are leaving, and now you have to factor in the cost of onboarding, hiring. You have to pull your efficient staff out of production to train. And then there's that indirect cost of they're not productive for a long time, right? And then, of course, the technology aspect I mentioned and shared resources. Most really good partners will have automation tools, analytic tools that you're not paying for, because they do that. So they can tell you what your days in AR are in, what are your common denials, things like that. And then the last thing that I cannot stress enough is the idea that today we run our business as a single threaded operation. You have one biller, you have one front desk person. Nobody knows how to do each other's job very well. So when that person goes out on maternity leave or gets sick or quits, things come to a grinding halt and you are struggling, right? So when you are partnering with teams and vendor partners, outsource models, then you are a multi-threaded organization. You might not ever know that the person that was posting your payments left, because there's 3 or 4 people assigned in your pod to post your payments. They know the specifics of your practice. They have access to your database. And when Susie goes out, John foots in, you don't even know it. We need to get to this idea of being multi-threaded. So all of that is great in concept, right? When you go to any of these business management meetings, they're going to talk to you about economies of scale. But what do you do to even determine if you need outsourced billing, right? And I did this sort of as a checklist, so you guys can leverage this to see if some of these issues resonate with you today. And then you know that this may be something that you want to look into. You do not need every box checked to feel like there is enough of these hot topics that you could benefit from a partnership model. And I don't like calling this outsourcing or vendor, management, because you should never turn something over to a billing. It's a co-sourcing model where you are partnering with a team that is going to fill in and multi-thread your business. You're not turning things over, you're partnering, right? One of the biggest things you'll see is 1 month you're bringing in 20,000, the next month you're bringing in 40,000. How do you manage those cash flow disruptions? How do you make payroll? Like that inconsistency is really going to impact you more and more as you are investing in capital. Like you are buying machines, you have more staff. You cannot have inconsistent collections. And of course, I've talked ad nauseum about staff turnover. But again, I've mentioned it previously on the last slide, but we know the EHRs are not necessarily built to give you every nuanced key performance indicator. You should have a billing team that should be able to show you on a dashboard at the tip of their fingers, right? I can tell you, we are currently building that for our ChiroTouch RCM clients. We are not going to be commercializing this for the ChiroTouch larger market for probably another couple years. But that is one thing you want to look for is, are you able to provide this so you can prove your worth, right? You want your biller to do that. So again, how do you select the right partner? So again, I did this as a checklist. Number 1, and I can't emphasize this enough, industry experience, right? You want to ask your vendor, your partner, how many chiropractic clinics do you manage today, right? In ChiroTouch, we manage over 300 clients in the chiropractic space. Some of those are one doctor, some of those are huge, group practices. And our teams only work in chiropractic care. And so, you are going to get somebody who understands things like PI claims, subrogation. Now, we're not the only one that does it. So I'm not saying you should not go out and figure out who specializes in chiropractic experience. But the other thing is, when you are talking to a partner, how many clients do they have on your system? Because if they say, oh, yeah, we've got a ton of chiropractic experience, but it's all on this other platform, you know that every EHR, every practice management system has its nuances and its idiosyncrasies. So if they have 3 clients on ChiroTouch, or they have 0 on ChiroTouch Cloud, they're all on Classic, how are they going to be able to manage your business if they don't know your system of record, right? And again, do they have client support? So many of these vendor outsource models will not have support, right? You cannot reach somebody. You do not know who you're speaking with. It's all done through chat bots and things like that. So making sure they have that customer support. Again, making sure they have security measures is always important. Again, ask them what KPIs they track. Tell them you want them to track these. Now, I do put client references on here. I actually don't love client references because any vendor is going to call their favorite client and say, hey, will you talk to Advanced Chiropractic in Washington, D.C.? Of course I will. I love them. But they could have, out of their 40 clients, they could have 5 that are happy and 35 that aren't, right? So I think you just have to be mindful of, client references. And if you do talk to a reference, be specific. This is my problem. Have you encountered that? And how do you know your biller has overcome that pain point, right? Scalability, right? A lot of these, vendors are spun up out of nowhere. How many people do they have? Do they have that multi-threaded approach? So with that, I just want to comment that ChiroTouch is oftentimes your EHR, but we also have a portfolio where we can be that trusted partner. Of course, I'm going to be biased to our billing services. I'm the vice president of it. So I can tell you, I have designed our revenue cycle management program against all of the things that I just spoke to. But we also have, let's say you love your biller, she's been with you for a long time, you trust her, but you don't know if she's using our integrated clearinghouse, ProClear. Or, did you know we have integrated merchant services? So when patients are taking, credit card payments, you're not swiping it from your phone, widget and then hand keying it in. That is rife for potential errors. But we also have, you don't need a whole marketing team if you're a small business. We have, the patient engagement platform powered by Doctable here. So we really want to be that portfolio. What does your business need and how can we partner with you?
For those that are currently ChiroTouch, either server-based or cloud customers, and you would like additional demos of this information or speak with a specialist, please feel free to use your phone to scan the QR code and go ahead and sign up.
And I think on my bio page was my email. If you have really specific, critical needs that you want to reach out to me directly, I will try to get to those emails directly. Certainly the best way is to go through this question module because I will have my teams on that. But I also want you to know that's the culture that I've created here for ChiroTouch is I am not some figurehead sitting in a corner office. My clients have access to me. So I want that for, our ChiroTouch, clinics that really are looking to partner with us in a more holistic manner.
Excellent. And Christine, I'd just like to thank you for your time today and thank everyone else as well. Have a great day, everyone. And that will conclude this webinar.